everyone. Myself, Dr. Lakshmi, consultant obstetrician and gynecologist from Penguinhospital. So today I would like to introduce a very up and coming topic about menopause. So a lot of females or middle-aged females come to me and ask about what is menopause. How do you diagnose that you are menopausal, or what are the problems that a female can encounter when she enters menopause or postmenopausal problems. So first of all, what is considered as menopause? So menopause is basically the end of the reproductive cycle of a female. So age-wise, Indian population falls anywhere. The average age of menopause in India is approximately 47 to 49 years of age. Depending on the genetics, the environmental factors, depending on your lifestyle, a lot of factors influence the age of menopause. But genetics does play an important role. So if your mother or your sister or your maternal aunts have gotten an earlier menopause, so chances are that you will also likely get earlier menopause, and vice versa. So menopause is termed when a female stops getting her menstrual cycle for one complete whole year. So for 12 consecutive months, you have not encountered a single period or single episode of spotting or bleeding, which happens during the normal period. So when that has not happened for 12 consecutive months or one whole year, that is when we term the lady as a menopausal lady, basically. So menopause not just entails the stopping or the cease of periods. So along with stopping of periods, there are a lot of hormonal changes that happen in a lady's life when it comes to menopause. So first of all, the bone health suffers a lot because estrogen hormone, which is secreted by the ovaries throughout the reproductive age group since the menarche, since the first menstrual period that we call as menarche till the last menstrual period. So there is a hormone called as estrogen that is secreted by everyone's ovaries. So that plays a very important role in heart health and bone health. So it protects the bones, as in it keeps the basically, just to describe in layman terminology, it keeps the calcium in the bones itself. And when the level of estrogen starts declining in the perimenopausal age group, so approximately 2 to 3 years prior to menopause, that is when we see a lot of brittle bones, a lot of bone related diseases, osteoarthritis as we call it today, a lot of joint pain, back pain, a lot of on and off body aches and fatigue. So all of this is in turn a result of low estrogen levels, which is in turn a result of anovulation, as we say, because the ovaries are at the end of their timeline and they sort of stop producing the eggs also, which turn into a healthy pregnancy, and they also stop producing estrogen. They do produce estrogen a lot of years after the menopause, but the levels of estrogen are definitely decreased. So secondly, the most important thing that gets affected is the heart health of a female. So estrogen is also very, very closely linked to heart health. Heart health does not mean only the blood pressure of a female. Heart health also essentially means the coronary arteries of the heart and the aerobic capacity of the heart, or the capacity of the heart to pump blood throughout the body. So what our research suggests is that after menopause, females are quite at a higher risk of suffering from a myocardial infarction or a cardiac event such as stroke, so to say. So estrogen is a heart protective organ or a hormone per se. So when the estrogen levels decrease, so the female is also very, very prone for a heart attack, so as to say. So what to do to prevent all of these things is the next question. So as estrogen is a very, very important hormone, and it is linked to the hormonal cycle, which keeps the female body healthy and vital. So what to do if estrogen levels come down and after menopause the female is suffering from mood swings, low bone health density, or poor heart health. So first and foremost, the preparation for all of this should start at the beginning of perimenopausal age group. So after about the age of 40, 42, the female, every I think female should undergo a bone density checkup, also a basic ultrasound just to rule out any problems in the uterus and the ovaries and endometrial thickness. Is it too much? Is she suffering from heavy bleeding, or what is the cause of heavy bleeding per se? So all of these basic preliminary tests should be done as one enters perimenopausal age group. Irregular periods or irregular cycles along with very heavy or painful periods are also a part of perimenopausal age group. So all of these problems do pose lifestyle disturbances in any female's life. So what that entails is, if you are suffering from all of these problems, you should definitely visit your gynecologist. Plus, what you can do in the meantime just to improve your heart health, bone health, and any other problems that you might face in the menopausal age is that you should opt for a healthy lifestyle and diet modifications. So some of the changes, basically what that means is to avoid processed sugar, avoid any processed flours, such as maida, which is very bad for, in general, bad for very heart health, and it also causes a lot of weight gain. It can cause fatty liver, it can cause coronary artery problems, and a lot of other problems. So saturated fat, refined flours, refined sugar, these three things are best to be avoided. Along with that, moderate to high intensity strength training is very important in perimenopausal age group, because the muscles, as we age or as a person ages, there is a lot of lean muscle loss that happens. So percentage wise, it is, just to quote that, almost every year 1 to 2% of your lean body mass is lost throughout the aging process. So the only way to get that lean muscle body mass back up to the appropriate percentage is to go for strength training. Again, if it is not possible due to your bad knees or back pain, start slow, start with something moderate or low intensity, such as yoga or aerobics, and then go on to strength training eventually. But strength training does play an important role in menopause and prevention of all the problems related to menopause. So having an active lifestyle and maintaining a balanced and a healthy diet are of utmost importance when it comes to menopause. Plus a few supplements that are necessary, such as multivitamins and calciums. They are absolutely necessary to maintain the bone density and to protect your heart from all the adverse effects of menopause. So definitely do visit your gynecologist. And if you have any other questions related to menopause, please feel free to leave them in the comments down below. I would like to answer each and every one of them. And if you want to contact me related to menopause or related to any other gynecological and obstetric problems, there is a link in the description. Please feel free to contact us. Thank you.